So I think we have time for a few brief questions. And let me, please come up to the microphone, but let me just take the prerogative of the moderator to say, we've heard a lot of best practices at the local level and in specific schools. So we're about to enter a presidential election year. And so if you were advising anybody who was running for president, who said, what's the policy implication? What's the lesson from your experience that you would say, here's the national policy that if implemented would make it possible to expand some of the best practices more broadly? What would it be?
I can answer.
Sure.
In my opinion, the policy implication is the same way we have a standard, and it's an accepted truth that all students must learn how to read and write and do arithmetic, that they would also need to learn how to manage their emotions and handle conflict and do all of these other real-world skills that people, none of us as adults, all of a sudden, poof, we knew how to do that. We had to learn that. And so in order to learn something, you need to be taught it. And so I would say that it needed to be part of the curriculum that every school is funded to provide.
Great. Other thoughts?
I would say that in the health realm and the mental health realm, that there needs to be more funding for school nurses in every school and school-based health centers, especially in low-income schools. I think federally qualified health centers is one way to do that, and there are incentives through federally qualified health centers to do more school health. But I think that there needs to be more attention to social determinants of health and school health resources.
Great. Thanks.
I would say just how do we ingest social emotional responsibility and STEM together? I know they're both very important, but we tend to emphasize them differently. But young people have to have both.
Great. Thanks. Question over here first.
Buenas tardes. Is this on? Yes. Thank you so much. Lourdes Rodriguez, Del Medical School, University of Texas Austin, and Roundtable member. So since health can be defined very broadly, if John had not classified you guys by sector, to the untrained eye, it would seem like there's a lot of similarities and overlap in terms of the areas of work that all of you work on, right? Your approaches may be a little bit different, and the language that you use to talk about some things might be different, but in general, somebody who would have walked in here and listened to your presentation would have had a really hard time figuring out who's representing which sector. However, funding for your work is convoluted. It comes from different places. What you do is so valuable. The worth of you do is great, but what people pay for it is very different depending on what your positionality in the world is. So could we talk about money for a hot second?
So sources of funding then, sources of funding. Yeah, please.
So that is an opportunity that different sectors have different funding streams. And so our approach to that is to leverage all of our funding streams together in the best ways possible. So for example, there is a lot of frustration in our system around Medicaid-funded mental health services in schools because in most schools, they're not 100% Medicaid eligible. So one approach that we have used in Alameda County is we do use this fantastic leverage of Medicaid dollars in our school system, but we don't build a system of behavioral health on the backs of that. It's an enhancement, and we try to find ways to blend funding streams. So one program that we have had for several years has been our Kids, Our Family program that we have in several schools in Oakland and Hayward here in Alameda County, where we have nonprofit mental health providers who do bill Medicaid, but we pair them up with other social workers, mental health professionals who do not bill Medicaid, and they work together as mental health teams in order to make sure that any student that needs mental health supports can provide, so we have universal access to mental health supports. So, and to do that effectively, to come up with those models, you have to really partner with education, with health, with even juvenile justice in some cases, come up with, understand each other's funding streams and weave them together for best possible impact.
Yes, Barbara.
Yeah, I completely agree with Lisa. I mean, the partnership building has to break down the silos. Unfortunately, we are funded very differently. I think the other approach that might make sense is an approach that recognizes you can be an all-in organization. And by that I mean is like you look at every single thing you do as building sort of justice and capacity for equity. So you think about, like, what does my contracting look like? You know, I'm a large organization. I have like $1.3 billion budget every year. And about 500 to 600 million is going out to community organizations. Now, I could dramatically increase my support for smaller community-based organizations if I paid attention to my contracting and smaller like what the rules are. And I actually changed some of them. So we actually increase the number of smaller minority-led, women-led organizations, LGBTQ organizations that were actually able to access our money. And if you did that, then the environment in which children live is strengthened because those community-based organizations are essential in many of our communities where government has in fact disinvested and business has disinvested. So, you know, that may not look like, oh, that's really directly going to impact the school, but it impacts the communities in which children and families live. And that's what I mean by all in. So your hiring practices. You know, we just set up a youth advisory board for the health department, and we pay those young people as interns. So they get paid to actually review all of our policies and how they actually will be realized and affect young people across the county. I mean, you can look at just about everything you're doing and say, you know, where's the opportunity for me to switch this up a little bit and support, you know, positive youth development. And so it doesn't just have to be like one program. It could be your hiring policies, it could be your contracting policies, it could be how you get advice and what you do to sort of solicit recommendations. You can, you know, introduce some, you know, new budgeting priorities that allow more voice in sort of how you're spending your money. So I do think that there's a way to think about yourself as an organization as having an impact both directly and indirectly in the lives of children.
I think that you raised the big key question is, you know, how do we get the money? And I'm jealous of some of the programs that were presented today. You know, our program started with philanthropy, but we are billing for Medicaid. And our Vision program, for instance, we are billing for Medicaid because we figure it's not going to be sustainable if we don't have some kind of sustainable source of funding. I think, as I mentioned, I think healthcare is more interested in programs like this as we are going away from fee-for-service to really thinking about population health and keeping people out of the hospital. So I think hospitals may, depending on the state and depending on what the incentives are and the payment mechanisms are in the state, are getting more interested in getting involved in the community and health. Payers, you know, whether that be private insurance payers or Medicaid managed care organizations are getting more interested as well. And I mentioned federally qualified health centers as well. So I think we have to make the case to a lot of people that are out there thinking more in this area.
If I could just weigh in too, I think that the place where there's the clearest sort of somewhat potentially unlimited funding source is where there's reimbursement from either Medicaid or a health insurer. And some of the services I think we've talked about lend themselves more to being considered a Medicaid reimbursable services, and some of them don't. I would think DBT probably restorative justice may not be considered a Medicaid reimbursable service, so there has to be alternatives in those cases. But we've seen at Trust for America's Health, we're working with 15 states to try to establish policies within the schools to bill for Medicaid, and we've got states represented here, I think, who are more successful in terms of already achieving that, but there are a lot of states around the country where there aren't Medicaid services that are offered within school settings, and where much work needs to be done in terms of either waiver or administrative policies, state policies that would allow for that tapping into those services, so that the kind of work that we've heard from best practices could be expanded in other locations. Yes, Phyllis.
My name is Phyllis Meadows, and I'm with the Kresge Foundation. It's my day job, and my other job is Academy board member, or member of this roundtable, I should say. I just promoted myself, Carla. You like that? Okay. So thank you all. This has just been amazing and inspiring to hear this work and to really reinvigorate our need to focus on this population of middle schoolers, young people. And just special thank you to Tebede, because I was really feeling at a point that my head was hurting as I was listening to the struggles of the young people today. But just the last presenter, Mr. Gibson, really helped begin to sort of crystallize in my head that our young people have assets too. Which was something that, you know, I didn't quite hear as much, but I know you can't work with them without knowing that they bring something to the table, and that their families do, and that their communities do, beyond just the supportive services. So I just wanted to just hear a little bit more about the assets that you're seeing in the children themselves and the teachers or the communities, things that we can build on and build more on. And then the last one, Barbara will appreciate this, prevention. A lot of the work that we often see is the work to try to fix what's been broken versus really trying to create an environment and reality that we want our children to live in. And I know you're part of that. So I just want to hear a little bit about assets and prevention, if you would.
Great, thank you. Who'd like to begin?
I'm happy to.
Good.
Thanks, Phyllis. You know, I mean, I think in terms of young people, this was my experience certainly, you know, when I was a principal at a high school, was the missed opportunities around the leadership. So I had young people who got to 9th grade and had never been part of any decision-making advisory body in their schools. There had never been student councils. I mean, we set it up so that we would have just a traditional student council. I had no idea that they had never participated. We get all the way through the elections, they're all excited, kids get elected, and the president decides like what it means to be, and he's elected president, is that he tells everybody what they're gonna do, right? So, and very clearly when we go around, it's clear to me that there's 18 elected people, students, and not a single one of them had ever participated in any form of governance in any setting at any school they had been in. They came from all over the city. That's a huge lost opportunity, and it actually should be starting, you know, in the earliest years, but certainly by middle school, young people, and I love that, you know, the speaker up there was like, you know, you need to pay attention to us. We have a lot of good ideas. We're closest to both the challenges and the solutions. And I think this is true of everyone. You know, we just miss opportunities when we set ourselves apart from others who are living their lives with their reality about the knowledge that they have because of that. And I think for young people in particular, you know, leadership training, the ability to be organized, the ability to come together. You know, I love restorative justice for that very reason, because what restorative justice does, certainly in a school setting, is it sets up peers as both leaders and decision makers. They get to actually determine the next steps that you're going to take. And I think having accountable communities is all about that. But in order for young people to have responsibility, we have to train them and we have to give them opportunities and skills. So I think on that side, I would say that you're absolutely right. Like, we have not made the investment in leadership that we ought to be making with young people. And I don't think it's ever too late to start, but the earlier we create that as part of what a thriving school climate looks like, the better off we are. And I would say on the second question around prevention, you know, the other piece I feel like we just didn't have a chance to talk about today was parents and caregivers. So they love their children. They all love their children. And, you know, part of what we could be doing is a much better job supporting parents and caregivers all the way through, and making sure that, and that's not the responsibility of schools or schools alone. That's the responsibility of everybody who's probably in this room is, you know, what are we doing to make it easier for parents to be able to not just love their children, but actually support their children. And I think we could have a whole conversation on, you know, sort of how do we come together around supporting parents and caregivers. So I think that's prevention.
Yes, please.
I just wanted to tell a story in terms of answering the first question. And this is to the credit to particularly middle schoolers. Middle schoolers are extremely resourceful. I'm amazed every time I go to work. In Denver at the Restorative Justice International Conference, in the large circle and workshop that 6th grader, 7th grader, and 8th grader, there were 6 girls, 2 6th, 2 7th, 2 8th grade. And they put on this workshop, and it was in circle form. There were people waiting in the hallway trying to get in. There were 90 people in the room for 60 people. We had to make amends because so many people wanted to see these middle schoolers do that work. And as the circle went on, and after the circle, there were educators and service providers from all over the country, and there was a principal from Minneapolis that had the talking piece and asked, you know, I'm just curious as to who your teacher is, because I know they're in this room somewhere, or who your mentor is. I know they're somewhere in this room, and we're over here trying to figure out who it is in this corner, and we can't figure it out. And so, of course, and I'm sitting beside some people from OUSD, some other facilitators, and no one could guess it. But at the end, one of the students said, well, if you all guessed, and they couldn't. And so the student just kind of walked over to me, and the response was, I can't believe you let them just do it. Like, I have students, but I don't know how to let go. That was a major response that we heard throughout. And these are teachers and administrators of schools. And they say, I don't know how to let go. And I didn't understand that because I don't know how to hold on. Like, I don't want, like, please, are you kidding? Let it go. Let them do it. The worst they can do is feel like they didn't do a great job. That's the worst thing that can happen. But the best thing that can happen is, wow, you empower some young people to really go out here in this world and do some work. And that's the key to me. Hand it to them. Give it to them. Make sure they're ready, but give it to them and let it go. And I just want to say I feel really good that I'm the only male up here with all these great women.
If I could just add one other point about the prevention piece, and I'll tell a story too. I visited a school in a community, about 70,000 people, low-income community, where 1,000 people who lost their homes in Puerto Rico moved to that community after Hurricane Maria, about 400 children. And when we visited the schools were telling us that they were really noticing how traumatized these kids were in the behavior and their inability to concentrate on work. And they did a lot of work internally to try to help those kids and have the other kids understand. But when they investigated what was going on, the main things that were continuing to be traumatic in their lives were there was no affordable housing for the families that had moved, and the people who had moved, the adults, their parents, couldn't find work. And so they actually moved it out of the school system. They said, we identified the need, but the town, the city, needs to figure this out, because the solution is policy on availability of affordable housing and job training for people who had been relocated. And they spent a year focused on that, and that really reduced significantly what the kids had been experiencing. So the notion of the resiliency and the support around social emotional health are really important, but if there are things that can be done that just eliminate what's causing the problem, that's better, because it prevents the harm.
But I think your question was also about primary prevention. I totally agree on supporting families and supporting parents. I think some of it is poverty. And the National Academy of Medicine actually put out a recent report on how do we reduce child poverty in half in a decade. And I often feel like, we need wisdom, we need the political will, and we need the wallet. This report actually talks about, we already know what we need to do to reduce poverty, and it actually outlines what we need to do. So that's the wisdom. The wallet, it actually tells you how much this is going to cost, and it's not going to be cheap, but we know what we need to do. I think we need the political will to actually reduce poverty in families.
I know we're out of time, but I just really want to thank you for bringing up what was missing, right? And with all this talk about ACEs and trauma and poverty, what's going well? What are these kids and students bringing to the table? And our students, like probably the students at all of your schools, are just amazing. They are resilient and creative and so funny and super duper smart. And they're so generous. And they always, anytime they can, want to give back to their community. They have asked us as the adults, can we do community service? My grandma is in a nursing home. I think there are other people there who could use our help. Can we go there for Mother's Day? We have 3 of our adult staff, teachers and teachers' aides, who are graduates from our high school who have come back to work with us as adults now because they feel so committed to their community and know that they have gifts to give back to their community. So thank you so much for bringing that question.
Well, on that note, please join me in thanking this terrific panel.
Change of schedule. You may have noticed that we're running a bit late, and so we're going to scrap the exercise because we don't have time for it. And we're going to take a 5-minute stretch break, and really 5 minutes, so stretch and come back here. And then we're going to start with Joaquin and the next panel, and they'll have 45 minutes, and we'll use the last 10 or 12 minutes or so for comments from anyone.